Let's now focus on something that concerns all of us. COVID cases are rising in the country yet again, and in fact, today the daily COVID case count has crossed 3,000 cases. That is the highest since October 2nd. So the daily COVID cases are currently at the highest that they've been in close to 6 months now. And what's really concerning is that 14 new COVID deaths have been reported in the country, and that's significantly higher than the 1 to 2 deaths that we were seeing in the months of January and February. So while earlier only cases were increasing, now deaths are also increasing, and that is a concern. While governments are saying that there's nothing to panic about just yet, it's important to take your precautions. But to understand whether this could be the start of a new wave, whether it's a situation to be alarmed about just yet, we have experts joining us on the broadcast. We have Dr. Chandrakant Leharia, who is an epidemiologist and a health systems specialist. And we also have Dr. Rajiv Jaidevan, who is the Vice Chairman of the Research Cell at IMA Kerala. Thanks very much, doctors, for joining us on this discussion. And Dr. Leharia, if I can first start with you, I think that's a question on most minds currently. Are we witnessing the beginning of a new wave now that COVID cases have crossed 3,000? The daily count has crossed 3,000. Could this be the start of a new wave?
So to understand whether we are entering into a new wave, we need to put this in a perspective. When 3 years ago, the virus was new, even an infection was a cause of concern because the virus was entering into new territories. But now SARS-CoV-2 virus is in all settings, it's circulating whether infection is happening or not happening. So what we hear and see, we are reporting every day, is that daily new COVID-19 cases are essentially number of infections which are happening. But we also know that in the last 2 weeks, the number of infections have gone up by 15 times or so, but the number of deaths or hospitalization has remained largely static.
Right.
Let's also deep dive into the deaths or hospitalization. Majority of infections or majority of the hospitalization are in the people who already had a pre-existing morbidity and then they were detected with COVID-19. So the COVID-19 is not causing hospitalization if we go by the clinical science. So putting these two things together, now mere increase in the number of infections is not a concern. It is not a reason to argue that a wave is coming. So in my opinion, it is not a concern. It is no new wave of COVID-19 is coming because population is vaccinated, because people have a natural infection, and the meaning of infection, as was the case earlier, has changed. Infection alone is not an immediate concern for the citizen. Of course, it gives us alert or indication that we need to take some precautions, some preventive measures, but it's no reason to be worried. And final point here I would like to make is that considering SARS-CoV-2 is among us, the rise and fall in COVID-19 cases would continue for a number of times or for the months and years ahead. So every rise, we should not be worried, and we should be prepared for those things and only protect ourselves.
Right. So, Dr. Leharia, you're essentially saying that currently we can't say that it's a new wave, and you've also pointed out how deaths and hospitalizations are not increasing proportionately with the cases. Now, on that point, if I can come to you, Dr. Rajiv Jaidevan, while we've noticed that hospitalizations are increasing marginally, now we've seen an increase in deaths as well. 14 new deaths have been reported today, while for the last few days we were seeing that just 2 to 4 deaths were being reported. So, while that is a slight uptick, do you think it's a situation to be alarmed about just yet?
I would not be alarmed. In fact, I would agree with Dr. Leharia about where things are at this point. There is no doubt that there's an increase in number of cases, and that includes my own colleagues who have called in sick with COVID positive over the last several days. So there is clearly a spike in the number of cases. But most of these patients are being able to manage at home with home isolation, with a lot of fluids and paracetamol for fever and so on. Very few of the newly diagnosed patients are actually being hospitalized. But we know that a large denominator also can increase your numerator. In other words, with a large number of people testing positive, yes, some of them, especially those who are older or who have significant accompanying disease conditions, yes, they can potentially destabilize and be in the hospital. And from that standpoint, yes, we must also understand that As there is a birth rate for every country and every state and every city, there is also a baseline death rate, both of which are roughly the same. So if you look at the baseline death rate for the state of Kerala, for example, you can calculate it down to 680 per day. That is the number of people. That's a pre-pandemic mortality rate. That is just what is expected of the region. Now, among these people, clearly there will be some people who die at home. There will be some people who die in the hospital. Some people die of pneumonia, others of cancer, of stroke. And death is tragic. But now COVID also has been a player in that. Sometimes it may be a COVID positive status in a person who's already in a very bad shape, very sick condition. So when you hear the word 20 deaths occurred, it doesn't necessarily imply the same as though 20 people tested positive for COVID and died. That doesn't mean like that. Most of the people in the ICUs are people who are otherwise very ill from their own health conditions. And COVID also tends to aggravate their conditions. So I wouldn't want people to panic saying there are suddenly 20 deaths reported. It doesn't work like that. Now with increased testing, yes, we are aware, doctors are aware that many of these patients who are destabilizing could also have a COVID component to that. So that is also, I'm trying to put things in perspective here. I'm sure Dr. Ere will agree with that. So it is not exactly that these deaths are directly due to COVID. But I also have information that the majority of these deaths that have been attributed to COVID are also occurring in older individuals. So we saw how when Delta started, very, very young, say 20, 25-year-old people came, collapsed and died in casualty. So we are not seeing that kind of a carnage right now with this Omicron sublineage. I would not take it too lightly either, because we wouldn't want the hospital systems to be overburdened, because we don't have a lot of beds. In fact, no country has a lot of beds in, to treat a large number of people who might arrive suddenly. So it's important to have some baseline precautionary measures.
So I think the message is that there's nothing to be to panic about, but of course we have to remain cautious so that we don't see another wave after those lessons of the three previous waves, of course. And while we talk about the cycle of the coronavirus, Dr. Chandrakant Laharia, as you said, that this is something that we'll keep on seeing. This is how the virus is also, of course, evolving. So is this something that we'll see every few months, a spurt in COVID-19 cases? And do you think that there's a fear of a new COVID variant, or it's the XBB 1.16, the sub-lineage of Omicron, that's driving the surge this time as well?
So there are some countries and especially some states in United States of America which are doing detailed, very robust surveillance. And what has been noticed in the last few weeks, that the number of infections and deaths caused by COVID-19 or SARS-CoV-2 is far lower than other respiratory illnesses. So now, definitely, this is an indication of things to come, that SARS-CoV-2 or coronavirus has become just like any other respiratory viruses. So we should be paying attention to all respiratory viruses. That's one. Taking simile from here, we can say that we know that respiratory viruses follow a certain pattern in different countries. For example, in India, the respiratory virus peak increased somewhere around rainy season, July to August, September, and then December to March. We saw recently H3N2. So respiratory viruses follow certain pattern. It's very likely that SARS-CoV-2 will follow that same pattern. Talking about the variant, the specific point is that this is the first time in last 15 months that no new variant of concern has emerged. The Omicron was the last variant of concern in November 2021. And very recently, on 16th of March, the World Health Organization had designated the previous variant of concern. So we are the first time after the COVID-19 pandemic with no variant of concern is going on. These are the subvariants, and there are 100 plus such variants. We should not be worried about subvariants.
All right. Thanks very much, doctors, for joining us on that important discussion on COVID-19.